Do you have chronic sinus problems? You feel pressure on one side, or when you breathe, you can only breathe through one side and not the other? Or you have chronic postnasal drip down the back of your throat. The mucosal lining in these sinuses is a very sensitive type tissue. And the reason people have sinus issues most commonly is the nerve that controls the sinus membrane is the trigeminal nerve, which is the tract of it, or the nuclei, is actually in the cord and the brainstem. And when an upper cervical misalignment occurs right here where the head and neck junction fits, it can put tensile stress on the trigeminal tract, and that can cause the nerve leading to the mucosal membrane to not function the way it should, and it predisposes the sinus membrane to becoming overactive and sensitive. And that's when pet dander, allergies, and things cause the sinus membrane to become even more sensitive, these types of issues. So if you're dealing with chronic postnasal drip, you can't breathe through one side or the other, or you always feel pressure in the sinus area, and you've done all the nasal sprays, you've done the allergy testing, and nothing has worked, you may want to look at an upper cervical chiropractor who can evaluate if you have an upper cervical misalignment. If this sounds like you, leave a comment in the comment section below. We can find you someone who's specially trained at finding out A, if your upper neck is out of position, and B, if it's out of position, how's it out of position? We use 3D imaging to ascertain how you're out of position. Everyone's different. And then a very precise correction is made to restore normal joint motion between the head and the neck, which allows the brainstem and the cranial nerves in that area to function better. So again, if this sounds like you, leave a comment in the comment section below. We can find you an upper cervical chiropractor in your area.